So the other thing that our kids take, or they have it in there, they do take a multi with, that I make sure has, good methylated vitamin Bs. Because low levels, especially for kids, if you're worried about, like anxiety, focus, things like that, we need vitamin Bs to make our brain chemicals. Can't do it without vitamin Bs. And our body can't convert them very well, so having the right form is pretty important. So making sure that you have like a methylated folate and a methylated, it's called like methylcobalamin for B12. So low levels will cause loss of alertness, moodiness, forgetfulness. Body also doesn't produce them and it doesn't store them. So they're not, are fat soluble, they're a water soluble vitamin or fat soluble. You could take 10,000 IU's of vitamin D one day and then you could be good for 10 days because the body will use it, it will store it and use it as it needs it. But a water soluble vitamin, body uses what it needs, pees the rest out. So vitamin Bs are one of those vitamins that are more important for every day. Like I said, the building blocks, you can't make your chemical brain messengers without them. And they're crucial for the brain. It's called neuroplasticity, when the brain learns, forms memories, and cognitive function. So for our brain to continue to grow and learn, we need them. And then the last one I put on here is vitamin D. I think we've learned a lot, everyone has learned a lot about that in the past couple of years. We know how important that is.
I think everyone assumes, since we live in a sunny state, that they don't need to take vitamin D. But I've had multiple patients come in who said, I had blood work and I'm actually at a 40, or I'm at a 20.
Yeah.
I'm so low the doctor can't believe, and I go outside every day for 20 to 30 minutes.
Well, a lot of people are really bad at converting that sunlight to vitamin D.
Yeah, you don't convert 100% of it.
You don't.
Yep.
So give our kids probably 800 to 1,000 IU's a day. And then I give it to them, vitamin D. Now, if you're giving them a multivitamin, check and see if there's vitamin K, but vitamin D doesn't work properly without vitamin K. One of the things that vitamin D, we all know that vitamin D is beneficial to get calcium into the body, right? Like, so if you're taking calcium, you need vitamin D to get it in, but then you need K2 to drive it into the bones. So you want the calcium to go to the bones and away from the arteries, because calcium is what is in, like when you get plaques in your whatever your arteries are plaquing, that's actually from calcium buildup. And if you're taking vitamin K, it will not allow it to build up in the arteries.
And I put some examples of, I know our kids, like we were trying to get away from gums, like the gummies right now, like gums are showing, I guess they're kind of screwing up your gut system. Is that kind of true? What's going on? Is it difficult to digest, or is it actually like breaking the intestinal lining?
Breaking the intestinal lining, too many gums.
Yeah, and I mean, your brain and your gut are highly connected there. So I mean, if you develop what's called like a leaky gut, if you're eating too many gums and too many vitamins or too many things that have, like every almond milk you see now has a gum, a binder that holds that together. But apparently that's difficult on the stomach now. So we're trying to put a couple liquids on here for people where it's just like the active ingredients that are in there, and it's not a whole bunch of other fillers. I think I did put some powders that you can just put in some water, so our kids usually like that. So if we call it Kool-Aid in our house, it's got a berry flavor, but it's got the magnesiums, it's got the things that we're going to talk about here. But